My name is Amy, and I'm going to be showing our patient today, Savannah, how to use their Ozempic pen. So when showing a patient how to use a medication, you want to make sure you have all of the necessary items on the table. You'll want to, and make sure it's a nice clean space, and just have exactly what you need and not a lot of extra things. Make sure it's not cluttered at all. You want to have an alcohol pad for wherever they choose the injection site, the pen needle, the Ozempic pen. You want to have the Ozempic man, which you can find these over in the Diabetes Center, and this shows them all the injection sites that they are able to pick from. And then we will be using this just as a demo so that they can actually feel the Ozempic pen going in here without having to demonstrate it directly on themselves during the appointment. You will also need a sharps container. We don't have one here, but it would be good to have a sharps container as well. So when they need to dispose of the pen needle, you will have that too. Okay, so today I'm going to be showing you how to use your Ozempic pen whenever you go home and use it. So just some things that you'll want to have ready is the Ozempic pen, a pen needle. So this will go on top of the Ozempic pen. I'll show you how to use that. You'll want an alcohol pad, and that's just to clean the area that you will be injecting. And then that is all the items you need. You will need a sharps container as well, one last thing, and that's just to get rid of the pen needle whenever you are finished.
And do I need a sharps container? Like, do I have to go and buy one?
No, you also can use a milk jug, a 2-liter bottle, or a laundry detergent bottle, just anything that's an empty hard plastic container.
Okay, great, yeah. Thank you.
Okay, and then once the patient, they have all of the supplies ready, you will want to tell them to make sure that it is the right, like the right medication, the right dose, so the Ozempic and whatever dose they are taking. Also, if they take the cap off, make sure to look at this little clear window here and make sure that the liquid is clear and colorless and it doesn't have any floating particles around. And also the last thing is to look at the expiration date and make sure that this medication is within date. And if all those things check off, then it is okay to inject the medication. Okay, so now that you have introduced all of the things that the patient needs to do the injection, you will want to tell them how to prime the pen. So this is going to be for the very first use of the pen. And only for the first use. So you'll want to, in this window here, turn it until you see 2 dots. Just one click right there. You'll see the 2 dots. And then you'll want to attach the pen needle. And then I'll do it with the patient, but you'll want to attach the pen needle and then press the white button until you see little drops come out. And at that point, then it is primed and ready to go. If you don't see the little drops come out at the top, you can go ahead and put it back to the 2 dots and press it again. And you can do that for up to 6 times. So I'll go ahead and show the patient how to prime the Ozempic pen. Okay, so whenever you first get your Ozempic pen, it is a multi-dose pen, but the very first time you're gonna want to prime the pen. So how to do that is you'll want to take off the cap, and then we'll want to attach this pen needle that we were talking about earlier. You'll just want to take off the top portion and put it on and turn it clockwise until it stops moving. We're just screwing it on. And then you'll want to take off the top cover. Then we can go ahead and turn it till we see the 2 dots here. And then just one click over, carefully take off the top. And then we will want to press this white button and until we see a little dot right there. Okay. So like we can see here, there's a droplet at the top. So it is ready to go. Now, if you don't see that droplet, you can go ahead and redo that process up to 6 times. Okay. But as soon as it's nice and primed, we'll go ahead and put the bigger cap back on. Set it aside, and then we will then go on and choose an injection site. So I'll show you how to do that next.
Okay.
Okay, so once the patient has already primed their pen, we'll go ahead and talk to them about choosing an injection site. So you'll want to grab we call this the Ozempic man. He's over near the diabetes center out with all the displays. You'll want to grab this so you can show them. And any of the orange spots are good places for them to inject. So 2 inches away from the belly button, top of the thighs, and then the back of the arms or the upper butt. We normally just tell people the top of the thighs or the stomach. They're just a little bit easier for the patient themselves to do it. The other sites, they would probably need someone else to do the injection for them. They're a little bit trickier to get to. So I'll go ahead and tell the patient on which sites to pick, and then also to make sure to rotate the sites every single week, and then to use an alcohol pad to wipe the site clean right before they use it. Okay. So now that you have your primed pen ready, we'll go ahead and pick an injection site. So good injection sites are highlighted in orange here. They're 2 inches away from the belly button or on your upper leg and the thigh area. And you also could do the back of your arms if you have someone who's willing to help you with the injection. But all those are good sites, and every single week you will want to rotate the site. So it might be good to write it down, just to remember what the last site was to make sure it's different the next week.
And do I have to rotate from leg to stomach, or can I just rotate around my stomach?
Yeah, so you can rotate around your stomach or around your thigh. Just can't be in the exact same place every single week, but it can be on the same part of your body.
Okay, good.
Yep. And then also, before you inject, you'll want to make sure that the alcohol, that you use an alcohol pad, just to make sure the area is nice and clean, and make sure that it evaporates before injecting the Ozempic.
Okay.
Yep. Okay, so now that I've shown my patient how to prime the pen, how to choose an injection site, we'll then teach them how to do the actual injection. So you'll want to grab one of these so they can play with it and actually feel how to do the injection, and have an alcohol pad ready, just kind of show them how to do it. And then also finally twisting it to the right dose of medication. There are 2 different doses on this pen, so making sure that they're twisting it to the right one. And sometimes people don't realize that if you twist it to the 0.5, you can go back still and go to the 0.25. You don't have to do that. It does go both ways. So next I'll go ahead and show the patient how to inject the Ozempic. Okay, so once you are ready to inject, you've chosen an injection site. You will want to use the alcohol pad and wipe it clean. And then we will be using this today just to kind of show you how to do it. You'll want to twist it to the right dose of medication that you are needing. Then take off the outer cover, and then into the area where you just swabbed. You'll just want to put it in at a 90-degree angle, just like that. And then press the white button until it goes down to 0. So you can see here that it went from your dose all the way down to 0. Okay. And then you'll want to hold it in the skin for an additional 6 seconds.
Okay.
And after those 6 seconds are over, you'll go ahead and take it out of the skin. Place the outer cap back on the needle. Then you can go ahead and unscrew it from the Ozempic pen and place this in the sharps container.
Okay. And do I have to hold down the white button the entire injection?
Mm-hmm.
Okay.
Yep, so you'll hold it down the entire injection until it goes to 0, and then at 0, then you can go ahead and release the white button for the additional 6 seconds. But you can hold it down the whole time if you want.
Okay, thank you.
Yeah. All right, so now that you have shown the patient how to do the injection, you can go ahead and tell them the storage for the pen. So after they have given the injection, they can keep this pen in the fridge, but they can also keep it at room temperature for up to 56 days. It's whatever they prefer. If they do keep it in the fridge, make sure it's not in the area near the ice box because that could freeze the pen. And if they keep it at room temperature, make sure it's not in direct sunlight because that could damage the Ozempic as well. All right, so now that you have completed your injection and your pen needle is in the sharps container, you'll want to go ahead and put the cap back on, and you'll want to keep this either at room temperature, but make sure it's out of any direct sunlight, or you also can put it in the refrigerator, but make sure it's not in the area near the ice box because that could freeze the medication. But if you choose to keep it at room temperature, it is good for up to 56 days at room temperature.
Great. Thank you.
Yeah. All right, and then now that I have shown you the whole process, I'll go ahead and you can show me how you would use your Ozempic pen.
Okay, great. All right, so I have everything I need. My pen, this is my first time using it, so I'm gonna prime it first. I'm gonna twist this to the 2 dots, just 1 click. And then I'm gonna put on my cap. So I'll take this cap off and take this off. Twist the needle onto the pen. Take the big cap off. Take the little cap off. And see a bubble. Oh, a bubble.
Yep. Primed.
And then I'm just going to put the big cap back on. Choose my injection site. Wipe it off. Twist to my dose. Take the cap back off. Put it in. Hold down 0, 1, 2, 3, 4, 5, 6. Take it out. Put the big cap back on. Twist it off, throw that away, and then I can keep this in room temperature for 56 days out of sunlight, and I can put it back in the fridge if not, just not under the ice box.
Yes, perfect. Sounds
Okay.
great.
Thank you.